My name's Chrissy and I'm going to be the nurse practitioner taking care of you today. We're going to do an assessment on your heart and chest and lungs. Does that sound okay?
Yes.
So when I first come in the room, I'm just going to take a look at the patient. Skin is nice and pink. I'm not seeing any cyanosis of the lips or any other discoloration. No major swelling in the legs. Hair growth is equal bilaterally. Sitting up, I'm not seeing an apical impulse, but we'll check again laying down. Can I see your nails? No cyanosis noted at the fingers. I'm going to feel for capillary refill, which should be under 2 seconds, which it is. And then we're also going to check for clubbing, which can be signs of issues. So if you'll just put your fingers together like this. Perfect. Kind of do that quickly with all the other fingers. Perfect. Looks nice and easy. So if you'll lay down, we'll start palpation. So we do palpation with the patient lying down. So I'm just going to assess the precordium by placing my hands along the apex of the heart and the left sternal border, and then on the arm, up high, on the sides. Great. So now I'm going to look for that apical impulse, which I can't see super obviously, so we're going to palpate for the apical impulse, which should be at the 5th intercostal space midclavicular line, which it is. And I'm also going to feel for the carotid artery, only on one side, and these should be happening at the same time, which they are. So perfect. So I'm going to have you go ahead and sit back up, and we will percuss for the size of the heart at this point. This is not necessarily the most definitive choice. If we had a major concern, I would be doing a chest x-ray to get a more specific look. But so we're going to start here. I'm just percussing for when we go from resonance to dullness. Looking for the base of the heart. We would be marking with a pin. Typically, the heart should stop at the right sternal border. If it extends beyond that, we are looking at enlarged heart. So now I'm going to auscultate the heart. And we're going to do that in 5 locations. First, I'm going to have you lean forward just a little bit. We'll start, not quite that much. We're going to start in the aortic area, which is 2nd intercostal space, right sternal border. And then we'll move on to the 1st pulmonic area, which is 2nd intercostal space, left sternal border. Then we'll move to Erb's point, which is also the 2nd pulmonic area, which is the 3rd intercostal space, left sternal border. 4th intercostal space, left sternal border is the tricuspid area. And then finally, we'll go to the apex of the heart, which is 5th intercostal space, left sternal or midclavicular line. When we're auscultating, we're listening for rate and rhythm, which his particular heart rate runs around 50 because he's an athlete. Usually we see 60 to 100. We're looking for S1 and S2, which is best heard at the apex of the heart, which were both intact and regular. We're also looking for any murmurs or any extra sounds, just S3, S4, pericardial friction rub, and none of those were present. So that's it for the heart. We'll now move on to chest and lungs. So again, if I were to come in a room, I'm going to see, is the patient sitting up? Does he have labored respirations? Is he in that tripod position? Is he air hungry? Looking for cyanosis of the lips or the fingers. Same with capillary refill. He's obviously not having any issues with respirations. So now we are going to palpate, and I'm just going to palpate his chest, feeling for landmarks. I'm not feeling any crepitus. I'm going to feel on the back as well. And I'm going to palpate for expansion. So I'm going to put my thumbs together. I'm going to have you take a good deep breath. My thumbs should move symmetrically, which they do. Noting bilateral chest expansion with my palpation. His chest is bilaterally symmetrical. His AP ratio is 2 to 1, just like we want to see. So now, after palpation, I'm not noting any crepitus, but I'm going to also assess for tactile firmness. So if you could say 99 over and over for me.
99, 99, 99, 99, 99, 99.
Assess on the front. Okay, again.
99, 99, 99, 99.
That's great. So I'm assessing normal vibration bilaterally in all fields. So now I'm going to move on to percussion. So I'm going to have you kind of cross your arms like you are, drop your head a little bit, and just lean forward. And I'm going to just listen, feel for resonance. We want resonance in all lung fields. Hyperresonance or dullness is considered abnormal. Good. Okay, so I'm going to have you now lift your arms up over your head and sit up straight for me. Just breathe normally. I'm noting resonance in all fields. Okay, you can drop your arms for a second. And let's see. Earlier when I felt with my thumbs, that was looking for diaphragmatic excursion. So I'm going to do that on the front here. So just kind of let those arms fall out and just take a big breath in. Perfect. Okay, so now I'm going to auscultate all the lung fields. And I'm going to have you do the same thing where you drop your head and kind of curl forward just a little bit. Take a big breath in. Through your mouth and just at a pace that's comfortable for you. Okay. So we're looking for lung sounds here. We want clear in all fields, looking for vesicular sounds across the lung tissue, bronchial sounds over the trachea, and vesicular bronchial across the major bronchi. And we will assess auscultation in all of the areas that we also used percussion. Okay, now if you'll sit up and put your arms up over your head again, I'm going to take another listen, so just continue to breathe through your mouth. Good. And then finally, I'm going to have you just say a few words, and we're just going to take a listen. Okay, we're just looking for vocal resonance. Now I want you to whisper a few words. Okay, so what I'm wanting to hear is muffled sounds. If we had clear sounds and I could clearly hear what he's saying, that would be abnormal. But in this case, it is muffled. And so finally, I want you to say E over and over.
E, 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 E.
Okay, that's good. So with that, we are looking for, while he's saying E, if I'm hearing A, I'm hearing A, which is normal, but if I could clearly hear E, that would be abnormal. So that concludes our assessment. Thank you very much.